And a good afternoon. This is Dr. Lieven speaking to you from Vila Moura in Portugal, from my home at my PC. And as promised, there would be a continuance to my first message that I dropped regarding some of the health challenges that I'm dealing with. And today I will attempt to share a little more, but without going medical. As a matter of fact, have the photos or images or videos regarding loin rupture, as they call it on one hand, inguinal hernia, a more professional description. The photos and the videos disgust me. I mean, when they begin to show surgery being done and cameras being pushed up in there, so I'm not going to do any of this. I don't like it myself. I kind of prefer that everything nicely stays inside. But at the same time, perhaps, at least for those who have gone through it, you'll be able to relate. And who knows if it ever happens with one of the members in your family or yourself. It's more common in men, about 10 times more common in men than in women. Don't know exactly why that is, other than those are the numbers. So it's sort of at a particular point, it feels like you have a little bulge. And please, men or ladies, don't get any ideas here. When we talk about a bulge in our underbelly, we could be joking about something else. But actually, even me just feeling it when I am out in quote-unquote public, like in a restaurant or whatever, is quite uncomfortable, because any man who goes down with his hands into that zone, you wonder, is he scratching his balls or what's going on? So I have to learn. It's a learning process. When some of the what should be inside the belly, which obviously in this case there is definitely intestines there, and there is a whole lot more. There is the bladder, there is the male or female organs, there is the kidneys, the liver. All of that is embellied in the belly, in the lower belly, and then there is skin with fat, etc. So just to put it in perspective, I did lose 28 kilos, and I'm actually delighted with that, because I'm right at my natural weight of 83, 84, which I haven't had for many years. Through some of the traumatic experiences, especially emotionally traumatic experiences that I've gone through, I have built a fat layer. It appears that actually was a wise thing for my body to do, because fat does protect you. And it was, to put it mildly, insane, one trauma after the other, into beyond reason. Anyways, I don't want to get into the details of that, other than my body, according to several scientists, did what it needed to do. It built a protection layer, sort of a shield. So fat can actually be of value. However, once then the trauma and the dangers are no longer present, it is important that that fat also gets dissolved. And it's taken, I've tried many different diets and this and that. And to be honest, none of it worked. I was at 112 kilos, and not a milligram actually would change no matter what I did. And I mean, even into, I drink one beer in the evening, a good German or a Belgian beer, and which is normally, pure natural. It's vitamin B. There is no chemicals in there. I tried to drop that because somebody said, well, maybe it's the beer. Oh, maybe it's the bread. You need to eat gluten-free. Oh, maybe it's you need to drink green tea. And you get tired of doing things that don't get results. I'll do anything if it brings results. I'm very results oriented in all aspects of my life. And I, at some point, have to be able to measure, is this effective or not? And honestly, after about 3 years of trying to lose that weight, I not gave up, but came to accept, okay, I have a belly. You know, now I look back, having lost that 28 kilos over about a 2-year period of time. I laugh about it. I say it's COVID who helped me to get rid of it. So, new diet to lose weight, get COVID-19. I'm joking. I have gone and looked 28 kilos. You can easily find 25 kilos a potato bag. That's a huge, I mean, here, I'll even... 25 kilos of potatoes. Let's take an image. You know, there we go. That's a 25 kilo bag. That is a lot of potatoes. If you're carrying, I wish they would show that. There we go. Is that a person behind it? Maybe it is. When you, I mean, that's, I dragged, look at this lady, 25 kilos on her head. I mean, it's like, imagine having that in your freaking belly. And I was pretty much carrying it all in front. I didn't enlarge much, a little bit in the neck. You can see my girdle or whatever they call it is pretty much gone. I feel much better. So the weight loss has been a very good thing. Selected potatoes. Good God. Now, getting back, let me see where that image is at that I first had up front. So, there is a point where that protective layer, the inguinal sheath, as they call it, which isn't really muscle, it isn't really cartilage, it's not bone, it's sort of a thin skin sheath, as they call it, that comes in several layers, about 7 layers. Let me see, there is a photo. Here you see how it, there is a layer here, a layer here, a layer here, a layer here, you know, so there is several layers. Yeah, here you can see the layers as well. There is several muscles that end up in there that have then their attachment to the bone, to the hip, and to the sacral bone. And see the blood vessels, and in case of a man also the sperm cord is actually all passing through there. So there are openings, natural openings in these sheaths or in these layers, protective layers. But when it begins to bulge out, and this is an exaggeration, it was sort of a little cartoon drawing that a piece of intestines pushes out and it creates this sort of bulge here in the front. I'm not going to show other pictures because they really get too gory and unpleasant and unnecessary. I mean, if somebody is into that, you know, type it in and you'll get plenty. There is many different degrees of this, and I think that I have an early stage of it, a weakening of the wall, of the abdominal wall, and that has on occasion permits some, whatever structure is there, I believe it's intestines, that tend to push outward. And I can feel it. The first time I actually had gone out with my bicycle, I come home, I lift my leg up, and oh, that didn't feel good. And I kind of felt right there in that region. Didn't realize, this is probably about a month back, that I got the first little signal. But then there was a moment where all of a sudden I had what I could feel was a bit of a bulge. And when you go lay down, you can gently, this is not by using very pointed force, more of a soft touch, that you can gently bring it all back to its normal positioning. When you lay on your back, naturally all the organs go towards your spine, and therefore it alleviates the front from any pressure. But then I had it, I think it was the day thereafter that I was in a restaurant, and right in, as I'm sitting at the table, it began to feel uncomfortable. I tried to pretend that I wasn't feeling anything, both for the people I was having lunch with, as well, especially for the restaurant and the other clients in the restaurant. But at a particular point, I started to get tears in my eyes. The friends with whom I was out with said, "Lieven, what's wrong?" I said, "Well, I'm not feeling good." And meanwhile, I'm like under the table feeling myself, which again, you really don't want to do that in public because they could have all sorts of other ideas. But I asked the owner lady of the restaurant, "Do you have a place where I could lay down?" She said, "I'm really sorry, we've got only the small little restaurant, the terrace outside, and the kitchen is so small that really there is only space for two people to just get around all the countertops." And I said, "Would you mind if I simply lay down on the floor?" And she said, definitely. She actually immediately brought a couple covers, put them out on the ground, and as soon as I could lay down, I was able to feel the pressure disappear. And somebody of the customers had heard something about hernia. And a lot of people generally, if they speak of a hernia, they think of the back and they think of the discs in between the vertebra. And so this gentleman came back inside with like a corset, which he had suffered a couple of hernias in his low back, and he figured this could possibly help me. And then I told him, I said, "No, it's not a hernia in my spine. It is of the belly." "Oh, okay, I'm sorry." I said, "No, I appreciate the fact that you're wanting to help." So it took a little bit. This is about a week now that I'm dealing with this, and every day I'm learning. I'm learning both from, what the information that is out there, and there is a lot of information that shows, good God, we have a university by our hand, many universities by our hand, just thanks to the internet, and but also coming to know another part of my body, which I never really had concentrated on. And I've gone through not only lots of anatomy, physiology, and all of these classes in the university because of my chiropractic training, but also I've done dissection, and but you don't. It's a very different thing to see things in the books, even to see them with your real eyes. On other people, or to hear about them, but then to feel it yourself. And obviously, well, maybe not so obvious. I know there is people that are a lot more pain tolerant than I am. I'm not. I'm a pussy when it comes to pain. I'm a crybaby. I can't stand any pain, and I think most women would agree that most men can't. As they say, if giving birth was something men had to do, there wouldn't be any babies. So joking aside, in this week I have learned that yes, there is a way, especially in the early days, if you can avoid that pressure by laying down, and I have done a lot of that in this past week. I have actually, in the beginning it's difficult because your back becomes tired from laying down. I feel for the people in the hospitals, obviously. Also, as I move around or sit or try to sit in the car, what do I need to do? What is provoking this protuberance, they call it, sort of a pushing outward of the stuff that should stay nicely inside? I'm not talking about an erection, so that's a protuberance too, but of a different kind. I try to joke a lot in what I experience. It's the way I deal with the misery of it and the uncomfortableness of it. I hope I'm not going to begin to scream all of a sudden in the middle of the video. That would not be nice either. So I'm actually at ease right now, and the area feels at ease. So I will go take a rest afterwards, because sitting still is something you really don't want to do. Doctors have recommended to put icing, cold, to decompress the pressure naturally. And there is several things I'll be able to do to try to naturally permit for the body to re-fortify this region, and for the stuff to learn to stay inside. Now, when you've lost 28 kilos, primarily carried in that underbelly, it's kind of normal that the organs have to find their way again, because that's like, I mean, there was not a child in there, there was like a big boy in there, a whole bag of potatoes, and that's gone. And that space, luckily I don't have flopping skin. People who do liposuctions, the skin sort of hangs there like a hat. I don't have that. I can tell in the past 6 months that my underbelly has done a lot of resculpturing of what used to be bulged and fatty and blown up, which I didn't like at all, to now, I'm not going to say that I have a six-pack, because I'm not into exercise of that kind, but anyways, my body is beautifully resculpturing itself to its natural weight, and that means now reshaping also not only the outside but also the inside. I think it's a combination of those factors. Now, all of this has happened with a background of me dealing with my intestines. About 3 months ago, just over 3 months ago, I made a very profound wish, prayer, command, almost like Moses made a command. I made a command that I wanted to renew my digestive tract from mouth to anus, the whole kit and caboodle. And you not only just wish for that, but you really, really command that into being. I know from both science, experience, that the digestive tract can rebuild itself over a 6 to 9 month period. I'm drinking aloe vera. That's one of the many things that I do, because that helps to clean out any stuck processes in the intestines. It also helps to regenerate cells so that renewal can happen. I mean, there is a lot of stuff going on in my body that is good, that is healing. But as I may have tried to explain in the audio or to some other person, healing, while it's happening, especially reconstructive healing, regenerative healing, isn't always pleasant in the moment. Anybody who's gone through serious healing transformations knows that. The healing process, I used to tell my patients in my clinic, it's a little bit like, okay, your house isn't a new house. It's undergone quite a few traumas. So now you decide to do a complete renovation in your house. And that sounds exciting, and it is exciting. But you then, now all the contractors are coming in with all these people and all their machines and all the dust and the dirt that they make as they begin the renovation. That is the moment that you wish you wouldn't have even started this. And that knows many different layers. Every day it's a different story. And believe me, I've had days and I've had moments that I protested it, that I said, God, really? I mean, when I discovered this, it was like, oh, and I needed that on top of it? Yeah, really, thank you. I have a very direct communication with my grand architect, my good, loving Father God. I'm thankful for that. Some people have wondered, what is this? Is Dr. Lieven, is he preaching religion? No, he's not, even though I am very deeply spiritually connected. And yes, I apply that in my business. I apply that in everything I do. When I post things that are politically related, it has nothing to do. I'm not into politics at all, especially the caliber politicians that are out there. Who the heck? It's because it affects all of our lives today, all of our economies, our finance, everything. So really in essence with both the scientific team built, here is our happy Frederick and Patrick in Belgium who decided to make a t-shirt with the emblem of the scientific team built. But I am sharing, and this is really the product in the scientific team build, many things related to wealth and how you build wealth, how you go from poverty to riches. The program itself permits also great contribution to that, even if you don't know how to sponsor, but also health, and health not only physically, also mentally and spiritually, and emotionally. So really, when you look at my channel, you get a mix match of it. And I get it, for people that are new to it, it's probably difficult to figure out, what is this guy really talking about? Is this a business? Is this a philosophy? Is this an education? Well, it's all of that. And I allow you to basically peek into my life. Now, I'm not the guy that likes to take, when I have challenges, I tend to retract in solitude, even from my friends. Some of my friends have said, but Lieven, why didn't you tell us about this? Well, because I don't like to put that on my front door. And I also don't want all that, and by the way, thank you for the prayers. I really appreciate that. But I don't share or post to, oh, please consider me having difficult time and I need your help, I'm a victim. None of that. Yeah, this is a situation. Somewhere along the line, I've helped to bring this on, or permitted to bring this on, and I don't have guilt over it. It is what it is, and you need to deal with it. So basically, that's what it is, sharing. I hope what I've shared here today, that has given you a little bit of insight, maybe made you realize, oh my God, the wonders of the human body. It truly, the human body is an amazing, the stuff that is making up the body. I always, from having studied anatomy and then also done the dissection on actual bodies, I came to one conclusion: that big architect, that is intelligence. It's not human beings who are intelligent. I'm surrounded, and I have been surrounded my whole life with some of the most brilliant people in different fields. I'm really talking some high IQ, super intelligent people, beyond normal intelligent. And yet every single one of them are humble people. My professor was one of the highest IQ people in the States, reading 3 or 4 books per day, remembering every paragraph. After 65,000 books, remembering everything in these books. How do you do that? That goes over my head. And yet, Dr. Virgil Crane would say, I just know enough to know that I know so little. It takes a genius. It takes a man with vast knowledge to be able to, watch out from these people who claim to be experts, who claim to be gurus, who claim to know it all. They're dangerously stupid and dangerously ignorant about their own. It's usually their ego that gets in the way. Anyways, this is yet another learning experience. I hope it's going to be over with. Timing wise, they're saying from a small swelling like this, or small rupture or small hernia, that 4 to 6 weeks. It can be 4 to 6 months depending on the size. And of course, if at a particular point it was to get worse, and it would be primarily because I don't manage it properly. If I go footballing and tennis playing and water skiing and bungee jumping, they should hang me upside down if they... I guess that you go upside down. No, thank you. None of this. So if I do what I need to do, there is a good chance that this will heal naturally, and then I'll do things in the near future to fortify it further and protect it as well. It's a learning lesson. But if not, if there is a point, there is a time where we need medical intervention and that perhaps surgery would be needed. I'm not greatly in favor of it, especially if it can be avoided, but I also respect it when it is necessary. So enough said on the subject. I hope you got a little bit of clarity on what's going on. In one of the next sharings, I'm going to share then a bit more update on what's happening with the scientific team build. We're obviously in summertime, it's quiet, relatively quiet, not only because it's summer, but it's COVID-19. People are, they're paralyzed. All the madness, all the craziness, chaos, confusion. Good God, the rules here in Portugal, they change every day. The government puts different rules. One moment a restaurant can open up, another moment there is only so many tables, another moment it needs to close. It's just ridiculous. It's killing the tourism. Anyways, that's a whole other subject. But I will continue to be in touch when I can. Thank you for being patient with me. Again, thank you for your prayers. I do greatly value and greatly appreciate prayers. I'm a firm believer in it, and when a group of people who really care about somebody pray together, and yeah, I do have a role to fulfill to make sure that I can continue to deliver with the scientific team build. And then obviously many of you know, hey, I'm going to be opening up these health hotels. I need to be in condition, first of all, to be able to handle such a monumental task, gigantic task, but also as a symbol. If I do want to be a little bit of a reflection of everything that can be done with our health. But maybe that's why God put it on my path to humble me, to make sure that I realize that that we have good understanding of the people that arrive both in our clinics, in our hotels, that we understand that they're going through. You don't just go through the discomfort of whatever disease or malfunction or irritation or trauma, but there is also the mental processes, the fear, the frustration, the sadness, the anger, all of that. That's all part of the picture, and naturally that influences our life, family life, our commercial life, professional life. So I'm going to close off with a blessing to all of you. Thank you for listening to this video. May I ask in Jesus' name that you may be blessed with abundant wealth in your body, in your life, and radiant health in your body, your mind, and your feelings, and in your spirit, that you may have peace of mind. God bless you. Take care.